So good afternoon. Thank you so much for coming. I think most of you know me. I'm Robin Koval. I'm the CEO and President of Truth Initiative, and I'm delighted to welcome you to our very first Warner series as Truth Initiative. So this is an occasion for us. As many of you know, we became Truth Initiative in September, introducing a new name that connects our award-winning truth public education campaigns with our best-in-class tobacco control research and policy studies and the community and youth engagement programs that together are how we speak, seek, and spread the truth about tobacco. We've also recently moved to our new home, which is right across the street from where we are today, and I hope many of you will visit us there on January 27th, which will be our New Year, New Home Open House. So please be on the lookout for an invitation. And as we explore our new neighborhood, it is a pleasure to be here in this beautiful space today at the National Portrait Gallery and in the Nantucker McAvoy Auditorium. So thank you for coming. As you know, through the Warner series, we convene public health leaders and policymakers for thought-provoking conversations about how we can innovate to save lives. This discussion series is named for Dr. Ken Warner, Distinguished Professor at the University of Michigan School of Public Health. And Ken has, of course, long been one of the leading thinkers and doers in tobacco control. He's our former board member, and we honor his ongoing contributions to disease prevention and health promotion by convening leaders across the public, private, nonprofit, and academic sectors to foster conversation and learning and inspire action. In addition to those joining us here today in Washington, we also have an online audience drawn from communities across the U.S. who share an interest with us in learning about the multi-year campaign to bring smoke-free air to all workers in New Orleans. Among New Orleans' many nicknames is the Big Easy, right? But there was absolutely nothing easy about achieving a smoke-free New Orleans. Community leaders and public health advocates in New Orleans have been laying the groundwork to strengthen clean indoor air laws since 2007. That was the year Louisiana's Smoke-Free Air Act eliminated smoking in all public places and restaurants, but exempted bars and gaming establishments. And over the last 8 years, a very diverse coalition of community members, including bar workers, musicians, casino workers, not the usual tobacco control advocates perhaps, has achieved a smoking ban that includes the bars and gaming establishments at the heart of the New Orleans culture and community. We look forward to learning how they laid the groundwork for a smoke-free ordinance that would protect the health of all workers and what they're experiencing since the ban went into effect in April, and how we can apply those experiences in other locations. Our moderator for today's Warner series is our own Dave Dobbins. As Truth Initiative's Chief Operating Officer, Dave spends most of his time at the intersection of our policy studies and community engagement programs, which make him the perfect choice for today's discussion, reflecting on how those two strategic areas support one another to yield meaningful results. And I also want to acknowledge the work of the Tobacco Disparities Working Group. After the 50th anniversary of the first Surgeon General's report on tobacco, this group convened to explore how we might better address tobacco disparities and how we might better work directly with communities most affected by the tobacco epidemic. And their work inspired today's discussion. And I would like to thank all the members of that group, many of whom are here, including Dave, for all of that effort. Before Dave kicks off the discussion and introduces our panelists, I want to ask our Washington and our online audiences to remember that this is a dialogue, so we encourage your participation. For those of you who are watching online, you can submit questions throughout the webcast. Dave will share them with the panel. You can email your questions to warner@truthinitiative.org. And please include your name and your affiliation along with your question. And then we'll open the microphones for audience questions as well after the panel. And during or after our discussion, we also welcome you to share your insights via social media. If you do, the hashtags are #WarnerSeries and #SpreadTruth. So now let's give you something to tweet about. It's my pleasure to turn the program over to Dave Dobbins and our panel, and thank you all very much for being here.
Well, thank you everybody for being here. I want to echo Robin's thank you to the Tobacco Disparities Working Group, a group of national tobacco control partners and groups representing diverse communities who advance tobacco control, came together and dedicated this year to really focusing our work on figuring out ways we can highlight the continuing problem of the disparate impact of tobacco. A couple of things other than the inspiration for this event that came out of that group were a revision of the bold goals those groups had adopted last year at the 50th anniversary of the Surgeon General's report to include goals for making sure that the benefits of tobacco control reach all affected communities equally and that we can bring equity to the devastating effect of the tobacco epidemic and eliminate it for all people, not just for some. Another project we engaged in was developing a working paper called Advancing Health Equity in Tobacco Control. That paper sets forth our vision for a more equitable distribution of the benefits of tobacco control for all communities receiving the life-saving benefits of reducing tobacco use and death and disease related to tobacco, and sets forth the facts that show that the impact of the tobacco epidemic still does not hit Americans equally. There'll be printed versions outside where you first came in, but we will be sending around an electronic version of the bold goals and the working paper after this event, so you'll have them there. As Robin mentioned, in many ways, this event is a capstone to our discussions of this year. As we talked, one of the things that came through again and again is the importance of engaging community where they're at and having policy change. And as we strove for terrific examples of how that was done, we came to New Orleans. In many ways, if you had asked me, as a relative neophyte to legislative change in tobacco control, list 5 or 10 cities that you think may never go smoke-free. Las Vegas and New Orleans would have been on my list, and not because the people of New Orleans don't care deeply about their health. I know that they do, but because it's such a tourism-driven industry there. But you guys showed that employing the exact strategy we were discussing in the group by getting the community to understand that this was something that they could do and wouldn't hurt their livelihood, but would improve their health, you could get a southern city that relies on tourism and casinos for income, that is notable for its wonderful, diverse population. You can get those elements together and have real change. So we think that this is a model not only for tobacco controls in cities, but tobacco controls in institutions, tobacco controls within community. And I'm really, really happy that you're here. Unfortunately, we were going to have council member Latoya Cantrell here today. Unfortunately, last night she fell ill and wasn't able to come. She was super gracious, and I answered some questions for us via conversation, and I have notes here on those answers. Councilmember Cantrell was one of the champions and co-sponsors of this law that finally got New Orleans past the entire smoke-free bar. She's a committed public servant, and from what I gather from you guys, absolute firebrand who won't be denied when she knows what the right thing is. Our speakers today, though, I've heard referred to by our colleagues in tobacco control as the dream team. These are the people that were working on the ground that got it done, among the people on the ground. Starting at the far end, Claudia Rodas, who's the director for the Southern Region of Tobacco Free Kids. She's been involved with tobacco control for many, many years. She's worked in many places that we would view as tough targets, being in the Southeast United States, instrumental in bringing real policy change to places like Texas and Louisiana. Tanya Moore, who's with the Louisiana Public Health Institute as an associate director. She was one of the people that's been in this for the long haul, who's been working for many, many years to bring a total smoke-free ordinance to New Orleans. I guess when people said it couldn't be done, you weren't going to listen to them. So
No.
I really appreciate the work you've done there on the ground. And last but not least, Jennifer Kofer, who, when she was working on this project, was with the American Lung Association of the Southeast, but now is with MD Anderson Cancer Center. She's another tobacco warrior, spent the last 15 years working in public health and tobacco control, and was instrumental in helping develop the coalition that was able to get this pushed through. We're going to have a lively conversation today. We'll have an opportunity for all of you to participate as we continue. I do want to remind everyone that you can submit your questions through warner@truthinitiative.org, and you can also tweet with Warner Series and Spread the Truth. So just to get started, as I said on my short list of hard targets, New Orleans certainly was one. What gave you faith that you could take on such a tough destination and make it smoke-free? Can I start with you, Kalani?
Sure, absolutely. I really think the inspiration, in my perspective, came from the community in New Orleans. Coming into the campaign, it was really a lot of our local partners who came to us and said, we really want to make this happen. That typically happens a lot when we go into communities. I think New Orleans was a little bit different because it was more than just our traditional partners that we hear. It was really the local community who wanted social change, and they were a great inspiration to the campaign.
What's your perspective,
Well, I
Tanya?
think the partners thought we were crazy when we said we wanted to do this. we had been priming all along since about 2008. As you heard, we do have in 2007, the state implemented a smoke-free law to include all public places, but it did not include bars and gaming. So we wanted to use New Orleans, since that's where we're headquartered, even though we are a statewide entity. We wanted to utilize some of the unique things and culture about the city and why people come to Louisiana and some of the other places. So we started doing surveys with tourists. We started measuring the air quality in the bars and the casinos. And we started developing that casework early on and started working and educating communities, especially about dangers of tobacco use, effects of secondhand smoke, different things that you hear about in tobacco control. We were priming them very early. And you know, I think it was in 2010. This was before the current council came on. And one of the council members who actually ended up being the champion for this, Councilwoman Susan Guidry, we brought it to her. She wanted to do it. But the other members of the council felt it was not the right time, and they would not support it. So, perseverance.
Perseverance.
Yes.
Did you think they were crazy, Jennifer?
I did. I was of that group that said, wait, did New Orleans just get mentioned as a potential smoke-free city? But then I did some research along with the coalition and found out there were 5,000 employees in the hospitality and entertainment industry that worked in a place still exposed to secondhand smoke, and 2,800 of those were in one building, specifically in New Orleans. That was the gaming industry. And that was my inspiration for why we should take this seriously and all get on board. And when we found out that this councilwoman was going to be the spearhead and leader, we needed to jump on her train because the train had left the station because she was determined. And I'm sorry that you guys won't be able to feel her determination. We hope we can replicate some of that for you. But the numbers of employees that were still exposed, and that doesn't count the number of patrons and tourists that do visit New Orleans that were continuing to be exposed. So that was the inspiration that quickly led us not to go crazy, but to become together on a mission.
It's interesting, what you've said is echoed in what Councilmember Cantrell said to us, which is the fact that it's a industry-driven town and it's a hospitality industry-driven town that wasn't a barrier. That was the reason why, because it's the people in the casinos and the bars who are most vulnerable. One of the things we also talked about is if you can do it in New Orleans, many people come through and they can learn the lesson that it's possible, and maybe they can take that lesson back to their hometown. So you might have been crazy, but it worked, and hopefully it'll get us to other places. You mentioned 5,000 employees who weren't covered. And one of the things I've heard a lot in talking about how this came through is how you engage those employees and how you were able to move them, perhaps from at first being skeptical, but to being advocates. I'd love to explore a little bit about what your experiences were in moving those employees to understanding the case and supporting you.
So I think the whole time it was about protecting the workers, right? So really honing in on the actual people that it was going to affect. Of course, in New Orleans, we have a huge music culture. So we started with the easiest targets, and that was the musicians. And so we had some famous musicians who were telling us they were tired of performing in smoke-filled bars. They actually were our best and brightest advocates for the campaign. They actually were the face of the campaign. They actually testified. They wrote letters. But not only that, they brought others on board. And so I think once everyone saw that the musicians were on board, other bar workers, bar owners, and a few casino workers quietly contacted us and said, you know what, we want to support this. And that was a huge way to start that movement there with a cultural approach to it. So I think that's what kind of set us apart from some other places, but it can be replicated because also there were other community members, neighborhoods, associations, and other folks who actually got on the train as well.
How were you able to cultivate those musicians to come around to your side? Were those relationships you had been building for years, or when they finally understood there was momentum, did they come to you?
Well, we have a partnership with the Louisiana Public Health Institute and the Louisiana Campaign for Tobacco-Free Living. We worked with the Louisiana Cultural Economy Foundation. They actually have a health initiative in which they help to provide health insurance or health resources to the musicians, because you think about it, they work and they survive off gigs, and so if they don't have a gig, they don't have money. So providing those resources, really observing and surveying some of the effects and impact of some of the performers is what really got us to utilize them in a huge way. So they wanted to be part of this. They said this is about them. The bars and casinos are their workplaces. So they were instrumental in bringing like I said, the bar workers and casino workers to also get on board, as well as some other community members. So that was huge, and that's a non-traditional partner that you normally would not have at the table.
Coming into the city, Jennifer and Claudia, were you surprised at those kind of champions coming to support you?
I guess I would say yes and no. I'm surprised they came in so quickly and so passionate. A big, strong partner like the Louisiana Cultural Economy Foundation, bringing in one of those non-traditional partners with those kind of workers who are for that community that are very visible. So I would say no, they should be at the table. It's one of those when we sit around the table saying who should be at the table and we start thinking through stakeholders. I think where I was surprised was to see how active and how passionate and how far they took this issue on, not being a traditional partner. We invest, our 100% time, and so did they. They were right there, right next to us. So yes and no. I mean, I think I was surprised. I think the other thing that I would mention, though, is finding the right venues for different partners to play a role. The musicians were very loud. They were very clear about the work that they want, how they wanted to get involved. But then you talked about casino workers, and they couldn't be as visible as the musicians were. And so there was a venue for them to, behind the scenes, sometimes anonymously share these stories. And then we had, not only us as a coalition, but strong council members like Councilwoman Control and Councilwoman Gidger, who were the voice for those casino workers. So yes, I mean, it was finding the different venues and the different ways to make sure that these non-traditional partners found a way to still be engaged and important into the campaign.
And I would add the other dimension was the faith-based outreach that we conducted along with the neighborhood outreach. New Orleans is a very neighborhood-rich city and very neighborhood-focused, especially post-Katrina. And we decided to do a strategic outreach to these two communities. One of the faith-based ministers specifically said at a prayer breakfast, I'm not ignorant to the fact that my parishioners may go visit the casino or in fact work there, and especially the 517 bars in New Orleans. I know that they're going to be exposed to secondhand smoke, so I'm here and I'm going to be an advocate for this ordinance. And he in fact was very influential in standing up for the policy to protect all workers from secondhand smoke, including patrons. So our faith-based outreach looked a little bit different, but we had a really successful prayer breakfast the day before. Councilwoman Cantrell and I and Tanya were there, and we said, the prayer worked the day before, changing some hearts and minds for a 7-0 vote the next day. But the faith-based outreach was powerful, and the neighborhood outreach. The neighborhood outreach was unique. There were even neighborhood bars that were unique to New Orleans. So that outreach encompassed everything from showing up and being there in the community to asking them to do tangible things, write letters, make phone calls, the traditional ask, but to non-traditional people. And going back to the musicians, I have never seen such dedicated individuals to standing up for something they truly believed in. Although I had to Google who Deacon John and Craig Klein and Paul Sanchez and Chubby Carrier and Irvin Mayfield were, I am proud to say I'm now Facebook friends with them because we were in the trenches together. All of us met weekly and talked weekly and strategically discussed how can we influence these decision makers because we knew it was right. It was the right thing to do, and I think we did a lot of the right things.
I know that some of the musicians gave powerful testimony in favor of the ordinance and were really strong champions. You had mentioned a particular musician at one of the council meetings, and I'd forgotten the story, but I wanted to make sure it got out here because it was very powerful.
So probably Deacon John's story.
And all of them are actually very colorful, and they may not get the public health message out there, but they got their message out there. So again, sometimes you create your own best practices. So Deacon John, who is an older musician, known in the city of New Orleans for he's always, in a nice suit, dressed, as they say, debonair. He gave a testimony about tired of, going to his friends' funerals and burying his friends who were actual musicians. And so that was a very powerful testimony, not just him, but hearing those that have lost friends also in the music industry in New Orleans. They're like it's a very close-knit culture there. And so to get some of them on board, like we talked about Grammy Award winners, Irvin Mayfield, Kermit Ruffins, these jazz musicians who are valued in New Orleans as well as across the country, actually. To hear them come out and provide that testimony, which was very powerful, and showing up the day of the vote, showing up the day of the introduction, the town hall meetings, they were there. We thought they were public health workers too, so actually they are. So.
That's wonderful. It's a great insight because you found people who really impacted every night in a smoky bar because that's how you make your money. Speaking of the bars and casinos, who were the people that fought you the most, and what tactics did they use against you, and how did you come back? How were you able to use your assets to get? I mean, you succeeded.
So I'll talk about, we had a lot of opposition, as any smoke-free campaign. Those who worked in smoke-free campaigns are fully aware. A lot of our traditional opposition, we know bar owners are going to come out for the fear of losing revenue. We know that behind the scenes, the tobacco industry is playing a role. There were a lot of opposition. I think one of the ones I know I was a bit surprised that came out as strong, and although we see them as an opposition group in many number of campaigns, they came out in full force, just as we were out in full force. On the forefront, we did see the e-cigarette industry come out in full force. So, we were there wearing our blue shirts at City Council. They're there wearing their black shirts, although we're a little bit confusing because in the front it says, "I'm not a smoker," and so we're like, okay, you're here with us. And then in the back it highlighted that they were actually from the I vape, I'm from the e-cigarette industry. So everybody had a color of their shirt. We were the blue ones. We were definitely recognized in City Council. But they came out at least one of the most visible opposition groups, and probably to the very end, we thought there may be some type of exemption for them, and we're happy to say that e-cigarettes are actually included in the law. So wherever you can't smoke in a public place, you can also not vape in there. And I think it's the power and the testament again to showing that the advocates from all across the city came out in full force.
I think another obstacle was just the culture change. New Orleans has always been known as a place you go and party, drink, and have a good time, and smoking went along with that. So changing a culture is not easy, and so in that came the tangible things we had to do, which was just the basic education of secondhand smoke exposure and making it real to those individuals of these are your kids, these are your brothers, sisters, mom, dads that are working in these environments. And if not, being a person from Mississippi that was just 3 hours away, I visited New Orleans quite a bit, and from college in my young adult life as well. And it was just part of going to New Orleans was the culture shift of knowing that was what you were going to be exposed to and having to walk out of a bar or wherever you were smelling like a cigarette. But for me going in, I knew that was a big culture change, and change is not easy, but it was always worth it. And so, yes, we knew we were going to encounter tobacco. We knew that we were going to encounter the gaming industry. But what we've learned with over 700 gaming establishments that are smoke-free in the nation is that this was not the first that this would happen, and that it was possible. And educating on those facts and trying to reach casino workers in alternative ways where they could submit anonymous comments that we could read on their behalf. They felt safe in doing that, instead of feeling that they had their job at jeopardy if they did speak out on their behalf. So we had a lot of obstacles. I agree with Claudia of the e-cigarette industry, but we got to tap into the resources at the CDC Office of Smoking and Health and have experts come and give testimony during city council hearing. And hearing from the experts, the city council members trusted the experts and the public health experts on including e-cigarettes in the law, which was one of the first in the nation to include e-cigarettes and casinos in a smoke-free law.
I want to talk a little bit about bars because, I've been to New Orleans a couple of times, although it's been a very long time. And I've heard you guys talk that you were actually able to build some champions, or at least some people who were willing to engage with you among that bar owner community. And I'd love to hear a little bit about the actual legwork you did to get that going.
So, and I know a lot of people have the French Quarter in mind when they think about New Orleans, but there are neighborhood bars and life outside of the French Quarter. We're talking 514, maybe plus, bars throughout the city. So, as stated earlier, culture and behavior changes is that's very hard. However, engaging them in the process, we hosted smoke-free happy hours, smoke-free bar nights. Early on, there were a couple of bars that actually implemented smoke-free policies for their bar way before the ordinance actually went into effect, which, again, that's the wave that we started to see. It started becoming the norm. I think before the ordinance, we had, 20% of the bars were already smoke-free. But it was the neighborhood bars that we knew would also be a challenge as well. And we're talking old-time establishments. Like there are some, the favorites where people go to. And I could think of this one lady who always challenged us. She seemed to find us at every smoke-free event, including the council meeting, to, display her, non-support of smoke-free. But that's okay. It was heard. And you had to hear the supportive ideas as well as the non-supportive. That actually made your campaign stronger. And when you hear from the bar owners, especially post, we're hearing revenue has increased, It has not stopped people from coming. I'm sure some of you may or may not be familiar, but we could take our drinks outside. So a lot of people are actually meeting friends outside the bar, smoking their cigarette with their drink, and going back in to patronize. So we're hearing the great stories that people are still going there.
Just to dive deeper on that, we did specific outreach to LGBT bars and African American bars and African American LGBT bars. We got really strategic and very specific.
There's a bar for everybody in New
There
Orleans.
is.
It's
It's very
awesome.
welcoming and inclusive in New Orleans. But that was strategic on purpose as well, that we really needed to engage all people from all walks of life, and especially those in the bars. If you think about those who work in the bars, they're usually the most underinsured or not insured, and usually work for the lowest wages. So those are the people we were fighting for, and educating the patrons. A lot of the bartenders had a great relationship with their patron, and they were afraid they would lose that relationship. So we had to make sure that we honored that relationship as well, and just said, look, this is what we know is going to happen, and what we knew is happening currently. So doing the strategic outreach during Smoke-Free Week, Smoke-Free Nights, those paid off tremendously.
It's terrific, and that's a lot of work. Although it does involve going to a bar. But
It was research.
right, a little bit of research never hurt anybody. And I was familiar with that outdoor situation as well. So the bar owners now, if they, one thing I've noticed, at least when I've heard about change like this, the bar owners actually become big champions in the employees because they realize how much better their lives are. I assume that's the same in New Orleans.
Yeah, absolutely. I mean, we just celebrated the 6-month anniversary of the ordinance going into effect this past October. We had a bar owner, and Tanya will probably remember the name more than I will, but he came out and he spoke in front at the press conference and basically said, yes, I was afraid that what was going to happen. We actually celebrated all of the night that the ordinance was going to go into effect. All of my patrons there, literally at midnight, we, put our cigarettes out together, and we accepted the ordinance and the change as it was coming. And now he loves it. He has seen an increase in his revenue. He's actually seen people, exactly we said, we're actually seeing people who are coming back. He talked about 2 specific stories where 2 of his friends have already quit smoking because they can't come to his bar and smoke. So he said, well, one of them stopped drinking too, which he's like, hey, you can drink, but you can't smoke. But yes, absolutely, we're hearing those stories over and over again, that those who were either reluctant or had some fear are doing just as good, if not even better.
I had a business owner outreach to me and post on my Facebook page that he was wondering why he was in a casino for 2 hours plus, and noticed it was because there was no smoke and he could actually enjoy the environment, and he thanked us for our work. That was just one of those feel-good moments of people really truly enjoying the indoor environments in New Orleans post the ordinance.
And if I could share, there was actually a celebration around going smoke-free. As I say, sometimes we do things a little different, but it was fun. So they made it fun going smoke-free. So there were several bars that did countdowns. Some were, very nice and neat. They even had their Facebook pages or social media in tune to it. Some actually did a second line across the bar to say, you know what, they did like the New Year's celebration countdown. There were champagne celebrations, free drinks. There were all types of celebrations. I know it made our partners a little nervous about celebrating, and then at the strike of 12:01 when the ordinance went into effect, but it actually made for another great party or festival, as we like to have festivals. But it was actually a very unique way of getting everybody involved, and it was awesome. It was great.
You can't have a party when you're getting ready to
That's
save
right.
a bunch of people's lives, when can you? I really love that. Let's go back to our friend, the gaming industry, because one thing I've observed is that that's sort of the last bastion of protecting smoky indoor air. How are they doing in New Orleans now? Are they complying? Are they coming around? Or are you still having problems with your casinos?
They're complying. In fact, a group of us were at one of the gaming establishments right at midnight when the ordinance went into effect. We saw them putting ashtrays out a few minutes before before it was midnight. They were clearing house, and then right at midnight, we saw management going all around, asking people with a cup of water, asking them to put their cigarettes out and giving them a lollipop.
Good.
So they had signs that were saying we're the best smoke-free casino in the South. They did a lot of promotion, self-promotion within their establishment. So we saw at least what I was able to see, some immediate compliance. Again, there's still fear. I think there's still conversations going on. Tanya can talk a little more about exactly what those stories are. But from what I was able to see, there was some immediate compliance to the ordinance. They knew it was coming, and they tried to do some things to get ahead of it. And, you know, they were out there right at midnight telling their patrons, you need to put your cigarette out.
It's good. Are they still as good now? Let's see, went into effect April, so we're looking at 7 or 8 months later. Or is it still holding up? Or
It's still holding up, and their doors are still open.
that's right.
I think, so many expected the sky to fall, but it did not. They're still there. And one of the things about the casinos in the New Orleans area, they really thrive off of tourism and conventions that come to town. And we kind of compare what's happening in the city to some of the revenue, because we have been tracking their revenue since April 2015, and actually we started looking at seasonal trends to see when they would actually dip and when they would rise. And of course, there were some months that showed a small dip, not a huge dip as was projected. And we also saw a huge rise in a couple of months in which there were a lot of events happening in the city, and actually saw some of the casino's revenue hit an all-time high in the last 3 years. So people are going. I don't think people are not going because it's smoke-free.
So, obviously the patrons are voting with their money. Have you heard any anecdotal or polling feedback? Do they like it? Your guy was able to stay and play, which I'm sure ultimately the casino owners are happy about.
Yeah, we've seen support. Again, Tanya could talk about much locally, but there was a poll that was done around this time last year that showed 2/3 of voters in New Orleans support the ordinance. 6 months after the ordinance went into effect this October, we were able to show that it actually jumped by 12 points. 78% of voters in New Orleans support the ordinance. And 9 out of 10 of them think that it is a much healthier place to go. So at least when we look at our polling data, it shows there's significant support among voters. In terms of anecdotal, Tanya or Jennifer have anything to share?
I remember the councilwoman forwarding us an email that was anonymous from a worker that just said, thank you.
Yeah.
Thanks for standing up for us. Thank you for speaking on our behalf, and continue to fight for us. It was very moving when we got that email.
One of the opponents that I guess I hadn't thought about the context, but Councilmember Cantrell said actually the state was a bit of an opponent here because so much revenue is kicked out by the city of New Orleans. Can you talk a little bit about that? And is that a continuing problem, or do you think that New Orleans will serve as an example for the rest of the state to maybe be a little more aggressive in where they'll go?
Well, I think actually it is a great example for other communities across the state, and hopefully one day we'll see the state implement a comprehensive smoke-free policy. I think timing was everything. During the actual implementation of smoke-free, New Orleans, we had our fiscal legislative session happening at the Louisiana Capitol in Baton Rouge. And this was also, I guess, the state was facing a $1.4 billion with a B dollar deficit. And so, of course, the opposition will use every angle that they could to try to influence some of the influencers to, I guess, make decisions that were very tough. And so one of the things that we knew were going to happen, we made sure to look for any type of preemption measures that were going to be supported. There was information about reducing the number of employees, excuse me, and there was just a lot of talk and actual reports from the Gaming Control Board, which is spearheaded by our state police as well. So yes, a lot of factors went into it. Those thoughts or reports were not true. We actually, again, that's what made us start to look at the revenue, looking at seasonal trends to actually see when dips would occur and when they would not occur, so that we would have something to base it off of, some evidence and some baselines to base it off of.
New Orleans is the biggest economic driver for the state of Louisiana. So, I mean, that was why state lawmakers paid attention. That's why they had fears. And, when there are fears, you have to battle that with facts. And so we equipped them with as much information as we had and not be so fearful of the what-ifs, but actually let this ride out. And we have seen some lawmakers, I think, that have said, okay, but that's just for right now, so we'll see.
Well, change is incremental. Did you do, what kind of public education efforts did you do to get to, individuals or get to the people? Did you do, I have this wonderful sticker.
We did a lot of stickers.
Yeah, can you talk a little bit about those efforts and how they affected the success of your work?
There was a lot of work on the groundwork for the past, 10 years, laying that groundwork from those in New Orleans. I think a lot of the work that was done during this campaign wouldn't have been possible if we didn't have several of our partners like the American Cancer Society Cancer Action Network, the American Heart Association, the American Lung Association, their local chapters, the American for Non-Smokers Right, Tanya's organization with Campaign for Tobacco-Free Living, our organization Campaign for Tobacco-Free Kids, partners like that were investing more than just manpower. They had 110% commitment into this campaign. I think some of it, just to tie it in, what was one of the things that some of our partners did during the campaign, the American Heart Association and the American Public Health Association, APHA, both announced during the campaign that they would only hold their conferences that bring in over 20,000 people into the city only if the community was smoke-free. So I think, Tanya and Jennifer can probably talk about more specifics of what happened to educate pre and up to the campaign, but I'd be remiss not to mention the work that wouldn't have been able to happen if it wasn't for our partner groups, if it wasn't for groups like APHA and the Heart Association making that large commitment to say we are not going to come back to New Orleans and bring in these type of people. And if you are smoke-free, it's okay. We know you're fearful because there are large conventions, and there are 100+ other organizations that have that similar policy to say you will be okay.
Hey, I'm looking forward to Truth Initiative being in New Orleans as soon as possible.
So I'll take the January to April timeframe. We had a 90-day phase-in before it went into effect January 22nd to April 22nd, which that window played in for a lot of opportunities like lawsuits that Tanya will refer to in a second. But we worked with State Department of Health because they were the enforcers. So we printed toolkits, and we printed toolkits for every business in the city of New Orleans, hotels, restaurants, bars, the casino, as well as just law offices, other businesses. Everyone got a toolkit. Whether they actually read it, we don't know. But they did get a toolkit, so everyone was educated tangibly, as well as a media outreach. We did street banners, we did airport ads, we did billboards. TFL had a huge landmark billboard that was right outside the Superdome on Poydras. We educated at all the festivals. We had street team, college kids on contract out there educating and saying, here's the smoke-free city. Get ready for that April 22nd. We had napkins in the bars. We had, you name it, any kind of collateral that could be used in the bars or the casinos. We tried to print it, give it to them, and have it on there that it was going to be a smoke-free city. So we had a lot of great examples of tangibly doing some education. For media, we had 900 stories, which equates to $2.75 million worth of earned media in our campaign. Mm-hmm. I don't think there was anybody that didn't know that there was a smoke-free campaign going on in the city of New Orleans or in the greater Louisiana Gulf Coast market. So the education was out there.
And, go ahead.
All right. I want to open up the opportunity for people in the audience as well. If we have any questions, now's the time. Are we using a microphone? We have a microphone right over here. Although I know Mark, he doesn't need a microphone.
Thanks very much. Wonderful presentations. To what extent were you working with a unionized workforce? And if so, were the unions helpful? And if we're looking at a national strategy, is that an avenue we should be exploring?
So with the casino workers, they don't belong to a union. So that's why it was very low key. They didn't want to. They wanted to remain anonymous because we are at will state, and they could have been fired or let go right on the spot if they, if they came out to talk about the importance of having a smoke-free an ordinance, as well as the bars. There are no unions for them as well, so we didn't have any union issues with this ordinance.
Do we have any other questions from online or in the audience? We have a question right up here. And we have another microphone.
Are there any specific communities that you would like to see emulate what you've done in New Orleans?
Yes.
It's okay to name them.
Every other city.
I'll go first. I'm a Mississippi girl, and so I now live in Houston, Texas, but I have a deep love for my Mississippi Gulf Coast and Biloxi and just the whole Gulf Coast can do this. And it's just the right time, it's the right champion, it's the right people on the ground, and it's the want to, as well as the river cities in Mississippi, as well as the Tunica area. And then that's going to bleed over into the rest of the lovely state of Louisiana. You know, my dream world, Vegas and Atlantic City. Why not? But ultimately, I would love to see the Gulf Coast emulate this.
So we have 9 cities that are smoke-free in Louisiana. The train is still moving to a couple of other cities, some major cities actually. Right after the ordinance went into effect in New Orleans, there were 2 other cities that actually implemented smoke-free, comprehensive smoke-free policies. One is definitely doing great.
You know, I guess my response would be, I mean, obviously I'd like to see every community be smoke-free across the nation, but we do have some active campaigns, some of them in gaming communities that are working to make their community smoke-free. So obviously Jennifer mentioned Mississippi and the Gulf Coast area, St. Louis, Missouri is a gaming community, and they're looking at it. So, I mean, there's a number of other campaigns I could mention. What I would say is those who, whether or not you live in a gaming or non-gaming community, it's take that step, get organized, make this change for your community. But I could name 100 other communities that I'd love for them to emulate the same thing.
We have one right here, and then another one right over here.
Thank you. Very inspiring presentations. I'm curious if you could think, what are the 1 or 2 real key game changers where, you know, a lot of communities struggle with this, and we sometimes have difficulty understanding why some just happen to succeed and others don't. What do you think was the magic pixie dust that just turned this and made it all work, or was it just the accumulation of all the little bits of hard work, or both? I'm just curious what you think the key ingredients were in making this so successful.
I think several things. Obviously, we'd be remiss to say that groundwork wasn't laid, 10 to 20 years before that. I think having the right champion inspired the advocates who, in fact, the traditional advocates sometimes get really tired and empathetic, and she inspired us. And so just finding the right champion. I think one game changer was hearing from a casino worker who had lung cancer, who was let go because he was in the hospital and had missed too many days of work. He had never smoked a day in his life, and worked at the casino for many, many years. So that was an inspiring moment when he shared his story in front of the city council and brought tears to council members' eyes, as well as quieted the audience. That was a game changer.
One thing that I've heard about this is that you went in the day of nervous about the vote, and then you ended up winning on a unanimous 7-0 vote. So maybe it was stories like that got you there, or was there anything else that day that was the moment you knew you had won?
Yeah, I think for me, there's a lot of things we can mention as a game changer. I would say, we all have the tools for those who want to work on an issue like this. We have the tools at hand to make this happen. It's really just get the tools and hammer and screw and do what you need to do. I think the one game changer that I would change is that the coalition came together and were unified and lockstep throughout the entire campaign. And we as coalitions sometimes struggle and obviously within themselves maybe have some disagreements, but we were in lockstep for most of this campaign. And I think for me that was a big game changer.
Yeah, and I think a perfect equation is having community plus coalition plus the council members, because you definitely need them in order to get that vote. I think that's a perfect formula to actually having that. And making sure that the people that the policy is going to affect is on board.
That's great. We had another question right over here.
Hi, thank you everyone for being here and sharing your experience and your successes with us. My question is pertaining to the opposition stakeholders that you guys mentioned, particularly with the e-cigarette groups protesting in opposition. Very pleasantly surprised to hear even that e-cigarettes were totally excluded, just as combustible cigarettes were as part of the legislation. So my question is, do you see any threats from the e-cigarettes or other opposition stakeholders as far as enforcement or as far as threatening the legislation more generally? Is there anything you're anticipating, anything you're seeing on that front?
I don't think we are concerned with the ordinances that are currently in place, but I can tell you that as we start to move across the state, their coalitions are growing, and they're really starting to understand the legislative process, which in the earlier phases they may not have understood, but they're definitely getting their following to come out to speak. And actually, they have their fact sheets just like we have our fact sheets and present that information. So if you could get your hand on some of those fact sheets, that would be great.
They are. Absolutely. We were in a community shortly after New Orleans where they were pulling some of the same strategies we pulled. And they're meeting with decision makers and they're educating on their science, which is, of course, not always lining up with our science. So that is an industry we definitely have to continue to seek out. We're in great anticipation of the Surgeon General's report coming out. Not to put that plug in right there, but that's the science we stand on as public health advocates, and we need that science. And that's what we stood upon and called the CDC and had them come in and testify. Even though lung cancer, heart, TFK, we were all there equipping them with our information, bringing in the CDC, which is the greatest public health authority in the nation, was huge for us. But the e-cigarette industry is very passionate, and they truly believe in their item, and they are doing some of the same things that we were doing.
And I think it's important to educate your council members or whoever the legislative body on what they are, and talk about the difference between e-cigs and vapors, because they also think they're different from electronic cigarettes, which are usually tobacco industry sponsored, and then the vapor community is something that's totally different. We saw that a lot. So a lot of education for us as well.
We have a question right here.
Thanks. Really inspiring stories. I'm Scout from LGBT Health Link, and I was happy to hear you reach out to the LGBT bars, especially the black ones, because we actually have a pattern. We've seen it in Rhode Island, Georgia, St. Louis, D.C., and I'm not sure how many other places, where the tobacco industry's picked off the LGBT communities and then had one or two entertainment leaders stand up and say, we need an exception, which has pushed the vote a different direction. So my question is this: what kind of reception did you get?
Yeah. I'll speak from the outsider that went to the LGBT bar that night for Smoke Free Week. I walked in and was welcomed, and we had our stuff covered everywhere, but just ended up having a fun time, taking our selfie booth and things like that. But I ended up finding a spokesperson that we used in some of our ads. His name was Ryan, and he's like, this bar is smoke-free because the owner was in New York when they went smoke-free, and he came down here to open a bar and said, I'm opening up smoke-free from the beginning. So it was one of those unique stories where we found not only a bar owner, but then a worker that also worked somewhere else in the hospitality industry as a restaurant, then bartender, then patron. He just pretty much just shared his story and said, thank you for fighting for me too. We get excluded all the time just because we're LGBT in our lifestyle. And it was really cool to experience that. And it was in the French Quarter, and it was a bar I'd definitely go back to just because it was a lot of fun, and they definitely educated word of mouth. I think, ways that we could never have reached those masses in New Orleans.
And I think the neighborhood bar we spoke of, he actually was worried about his clientele and, of course, revenue, bottom line. And so he said he was skeptical. And once it actually went into effect, he did, increase his marketing, especially on social media. And he saw people coming back. And he's actually the person that testified on our behalf at our 6-month celebration to talk about his increase in sales, more people coming out, and also the addition to some people wanting to quit. So it's what we found, it's also a great place to actually promote cessation.
That's great. Do we have another question? Go ahead, Maham. Oh, over here.
We have a question from Twitter, and it's from the handle Healthy Air for All. And they said, what is your biggest health goal for 2016?
Tanya?
To gain more smoke-free municipalities, and we're working on that.
All right. Do we have any other questions from the audience or Twitter? So can I take the privilege of asking the last question of this event, because I think this has been really interesting and something that Councilmember Cantrell said is, in New Orleans, you have to start at the community. I think that's true everywhere. But what did you find in this experience that was unique, and what is it that you would tell us in trying to change our friends, our workplaces, our cities, our schools? Where do we go to make that kind of change? And what did you learn from this experience that you think will make you more effective in that kind of small p policy change or big P policy change?
I'll go first. A phrase that I coined along the way was, what made New Orleans different was we found what were the treasures of the city of New Orleans and made them our assets for our campaign. So consider what are the treasures of the city you're working in and make that your asset.
That's great.
I think it really, opened the community's eyes to say, you know what, we can have positive change here in the city. We saw all walks of life. We saw people from different backgrounds and cultures coming together on one cause. So I would say it really brought some of the city's jewels and gems together. I would definitely have to say that's one of the things that has happened. And we're not hearing many complaints.
That's great.
Yeah.
I'm not sure I could say anything much different from Jennifer and Tanya. I think what I learned specific to this campaign that I didn't know about New Orleans is that there is a unique love and passion in that city. New Orleans, we think, is the sin city. It's where you go to drink and party and smoke, and it's okay to do that. And I think coming in from an outsider perspective into New Orleans that was not the case. And a city is not defined by what others define it. The city is defined by the community, and I found that the community had a love and passion, whether they supported this ordinance or they were against the ordinance. They had a passion to come out and speak and be part of a process. So I think what I would say to others is find those those individuals who are going to speak on behalf of, be passionate on your side, on our side about the health, and find a venue for them. Make sure that if they can't be vocal, find a way for them to be in part of the campaign, and invest yourself 110%. And smoke-free campaigns, we all know, are tough. They are tough campaigns. Probably when we talk about New Orleans, it was capital TOUGH, right? But it was worth every ounce of hard work.
And every ounce that we gained eating.
Well, I think those are all really good insights, and what I'm hearing is if you can find the heart of the group you're working with, and that's in the people, you've got a great shot, and that's awesome. I'd also think it would be a lot of fun to have a place that likes to celebrate so much, because I think we always can do more of that when we have our successes, and should be unabashed in our joy at the success of our work. So thank you all so very much. Thank you all for coming and participating online. We're going to have a nice event where we can gather together after this, and you can chat in person with the Dream Team. Thank you very much.